Hello guys, welcome to Dr. Science. So today our topic is about chronic dacryocystitis, which is also known as nasolacrimal duct obstruction. Okay, and in this we are going to talk about the treatment also. Okay, so everyone please draw the diagram with me. Here is a gland, and this gland is your lacrimal gland, and here is your eyeball. This is your upper punctum, this is your lower punctum. The upper punctum ends up into upper canaliculi, and the lower punctum is going to form the lower canaliculi. So this is the upper canaliculi, this is your lower canaliculi. Okay, eventually they will end up into a canal called as the lacrimal canal, and this canal is going to form a sac. What is this sac called here? This sac is called as your lacrimal sac. Now this lacrimal sac will eventually form a long duct which will connect to your nose. In the nose, especially your inferior meatus. Now what is this duct which is connecting the nose and your lacrimal sac? This is known as your nasolacrimal duct. Okay, I already talked in the previous sessions that suppose this is the nose. The nose is going to have three meatus. One is superior meatus, middle meatus, and the inferior meatus. So the nasolacrimal duct is going to get opened into the inferior meatus. The nasolacrimal duct opens into the inferior meatus of the nose. So what happens in chronic dacryocystitis? In chronic dacryocystitis, there is blockage of the nasolacrimal duct. Now why there is a blockage? This could be due to bacterial infection. Due to bacterial infection, there is a lot of pus formation there, which is leading to inflammation. Okay, and this is the main cause. This is the cause that is causing the nasolacrimal duct obstruction. Okay, the nasolacrimal duct is getting obstructed. So what will happen? Since there is no drainage due to nasolacrimal duct obstruction, the lacrimal sac will get enlarged. Okay, now this entire condition is called as your chronic dacryocystitis. Since cystitis means the sac is going to get inflamed. Okay, inflamed, that's the meaning of cystitis. Okay, so what is the treatment of this person? The surgery for this patient is called as dacryocystitis. I hope the spelling is correct. So the surgery is your dacryocystostomy. So what is this surgery? I will explain. Just please draw the diagram again. So this is the lacrimal duct, lacrimal gland, and here is your eyeball. Here is your upper punctum having upper canaliculi, lower punctum having lower canaliculi, ending into the lacrimal canal, and lacrimal canal will eventually end up into the lacrimal sac. Lacrimal sac will end up into the nasolacrimal duct, which will end up into the inferior meatus of nose, right? So as you can see here, the lacrimal sac is enlarged, right? In dacryocystostomy, what we will do is we'll just puncture this. We'll put a punch hole using Kerison's DCR punch. It is a machine, okay? This is the equipment that we are going to use in this dacryocystostomy. Dacryocystostomy is the surgery, and in that we are going to use a punch hole machine called as the Kerison's DCR punch, through which we are going to put hole in the lacrimal sac. Okay, we are going to put a hole in the lacrimal sac, and this is connected to the middle meatus. Please listen carefully. Middle meatus. Why we are going to connect this to the middle meatus? Because due to nasolacrimal duct obstruction, the inferior meatus is not working properly. So imagine, just use your imagination. Okay, the nasolacrimal duct is not draining properly into the inferior meatus. So what we will do, we will put a punch in the lacrimal sac through Kerison's DCR punch, and then we will connect that to the middle meatus since it is working perfectly. So I will draw the nose here. This is the nose. In dacryocystostomy, this is the superior meatus, this is the inferior middle meatus, and this is the inferior meatus. Okay, so in this surgery we are diverting the nasolacrimal duct to the middle meatus. Okay, this is important question. I hope everyone understood this chronic dacryocystitis. Now let's see this one. See this image. So here is your lacrimal gland. Here is your lacrimal gland, and this lacrimal gland is going to drain into the upper punctum or lower punctum, eventually into the canaliculi, and eventually it will drain into lacrimal sac. And here is your nasolacrimal duct. As you can see here, this is the nasolacrimal duct which is draining into the inferior meatus. This is the inferior meatus. I hope everyone understood this concept. So thank you guys.